Welcome back to The New Health. And today we have back with us Dr. Heather Gessling, our family physician in Missouri that we spoke with last week. Dr. Gessling, welcome back.
Oh, thanks. Glad to be here.
So glad you're here with us today. So last week we spoke a bit about direct primary care and the work that you're doing and the amount of time you get to spend with patients, which is invaluable. And this week I would really love to dive into a controversial topic right now, which is the GLP-1 medications that are being used out there for weight loss. So first, I'd love for you to explain to the audience what these medications are and if you're for or against them.
Oh, yeah, let's talk about it. It's a hot topic right now. I do use GLP-1s in my clinic. Actually, technically, they're GLP-1 receptor agonist, and GLP-1 is glucagon-like peptide. This molecule is a simple peptide, and it is a way to reduce appetite. And also, it can help with reducing blood sugar. The reduction of blood sugar is glucose dependent, meaning if you do not have high blood sugar, it will not reduce it should not. I have heard some cases where a patient is on a high dose and they're not diabetic and it has caused some low blood sugar. But in general, it does not dangerously reduce your blood sugar. It is a medication that is used for diabetes because of that reduction of blood sugar, but then they found that it can have help with dramatic reduction in weight through multiple mechanisms. And so the mechanisms can be beneficial and they can also be harmful. And so I'm for them, but I'm also not a big fan of them in most circumstances. I have patients that have claimed and to do everything right or have done everything right. They've detoxified, they've changed their diet, they've reduced carbs and sugars, they're moving more, and they're just not losing that weight. And in that case, in my clinic, I do use a small dose and I keep it small and titrate very slowly up on that dose. And what happens is they have slowed gastric emptying, which means that they feel fuller quicker and longer, which reduces their interest in food and reduces their interest in eating a lot of food. So they feel full, maybe within 6 bites of picking up, or starting a meal. And they may even, be on their sixth or seventh bite and taking that fork up to their mouth and they're like, ooh, I am full. And what I say is, if you're on that type of medicine and once you feel full, you must stop because it has an effect of some pretty significant GI disturbances. If they push past that feeling of fullness, they'll feel nauseated, they'll get severe reflux, they may even vomit because of that action on their gut. They're not moving food through their intestines at near the rate that they previously were. It really slows down the gastric emptying. Now, there is concern that some of this gastric emptying delay can be a permanent effect. I haven't seen that in patients. I'm not saying it doesn't happen, but I also do not titrate high up on this dose. Some of the problems with GLP-1s is that you can have significantly decreased muscle mass or bone density mass, especially if you have titrated too high or too fast. And so then you're really not eating much, which means you're really not getting much protein, you're not getting much fat, and it can have some significant effect, including, I'm sure people have heard about it, this Ozempic phase. If you're not getting protein, you're not getting that collagen in your system. And also there is research that shows that some GLP-1s can reduce the synthesis of collagen, and specifically the mRNA expression that leads to the synthesis of collagen and some enzymes that help produce it. So you don't necessarily want that. But the benefits of GLP-1s is that it can help reduce that food brain, that craving, that sort of focus on food that can happen in a lot of patients.
So is that we talked a bit about it slows down your gastric emptying. It slows down. So it's slowing down digestion too.
Yeah, it slows down digestion. And one of the things that I hear from patients a lot is that they feel so good on this medication. And I think one of the reasons is because when you slow down digestion, your body is getting a heck of a lot more nutrients pulled from that food than it was before. And our food is already so depleted of nutrients that if we're getting, maybe 50% more absorption of nutrients, I think it's going to make your brain feel good, your body feel good. I'm not exactly sure why patients feel so great when they're on this medication. That's just my guess, but you do get increased absorption of nutrients.
Well, that's very good news. That's your yes pro side of our GLP-1s. So you were speaking about the titration that you are using smaller doses. So I have two questions about that. Why are so many people using high doses? And the other part of it is, are you losing the same amount of weight with a small dose? I think that would be a curiosity for people who are using this for weight loss, because I know it's now a weight loss, it's being used for weight loss, not just for diabetes or hyperglycemia.
Yeah. So I use a small dose, but I do intense education about what they need to be doing at the same time as doing that small dose when I go low and slow, which is you really must cut out toxic foods. You got to cut out the carbs and sugars, and you got to eat a lot of protein and a lot of fat. And when people hear fat, they're like, what? But we've been told for decades, get rid of the fat because that's what makes you fat. And it's actually the opposite. Good, healthy fat, not the seed oils or vegetable oils, but good, healthy fat, such as butter and red meat fat um, and olive oil, avocado oil. Those things are not harmful. And in fact, I suggest getting a heck of a lot of it. It causes satiety. It causes your body's metabolism to switch into fat burning mode. But so when patients are getting those good nutrients, reducing sugars and carbs, reducing toxic foods, they can have significant weight loss paired with that low dose of GLP-1 that helps reduce their interest in overeating or their interest in snacking or just in general having that food brain where they're sort of, grazing all day. I would say that the benefit of the low dose is that you don't get that loss of lean muscle mass or loss of bone density, which has been seen. Now, the insurance companies, pharmaceutical companies are sort of pushing this heavy titration on patients. I have seen that some insurance companies are not paying for this medication unless I move up to the next dose. They refuse to fill it and pay for it at the lower dose, which is incredible because I'm the physician and I decide the dose, not the insurance company. But there's been this sort of brainwashing that you got to get up on that dose. You got to get up to that higher dose to really achieve that weight loss. But that's not what I've seen in my clinic.
Wow, so the insurance companies, they cover what has been studied, which are higher doses, and that's usually how that goes. And so
That's usually how that goes. Yeah, but
yeah.
I have used compounded GLP-1s in my clinic, the semaglutide, the tirzepatide. I have used those and we don't go through the insurance companies. And a lot of times with patients who have insurance, it's not that easy to get the GLP-1s covered. There are some that are FDA approved specifically for weight loss. It's still an expensive medication. So we have used the compounded forms.
When it's compounded, do you find it more affordable for patients
It's
when it's
more
compounded?
affordable. I have seen that there is some decreased potency on the compounded doses. Some companies more than others, but we still get the benefit of changing the food habits. The goal of that medicine in my clinic is to change food brain, change that food noise that patients get them away from this thought of eating all day. Once patients have been on a course of one of those GLP-1s, they notice that they don't think about food like they did before, which is a big win.
That's incredible. I love that. I think there's so much on for weight loss. How do we work with appetite? How do we make appropriate choices? And it sounds like what you're doing is you're helping people find appropriate nutrition plans and patterns to optimize their health and to help them with losing weight, but also optimizing their health and wellness through nutrition.
Yeah. Yeah, exactly. We want to be able to utilize tools when appropriate. I kind of say that the GLP-1s are my tool that I use to get patients off of other pharmaceuticals. Because if I can get them off their insulin, or I can get them off their antihypertensive, or some of these other medications that are used to help with this metabolic syndrome or diabetes, I consider that a win. There is so much that is done wrong with treating metabolic disease, just throwing medications at it, that if I can help them get off those pharmaceuticals and utilize this tool, I also consider that a win.
This is great. Thank you so much. I learned a lot about GLP-1s, our pros and our cons, about it's beneficial to help you get off of other pharmaceutical medications. It's beneficial for weight loss. The con being at high doses, we can see loss of lean muscle mass, loss of collagen. We as women certainly don't want that. And other adverse effects that you can see when you are taking these medications and you overeat. Thank you so much for coming and spending some time with us again, Dr. Gessling. Please tell us a little bit about what you have going on right now and how people can reach you.
Yeah, so if you're in the state of Missouri, in central or any part of the state, actually, you can find me at GesslingFamilyWellness.com. You can sign up as a member if you need primary care. I'm also doing a detox project with my good friend Christian Elliott, who's a health and wellness coach, and you can find us at www.healingunited.today. You got to put that whole thing in. Google's not good about just putting in healingunited.today. It may have been fixed, but you got to put that whole web address in. You can also find me at Twitter at @hgessling. And we're doing our next free 2-day seminar for detox, Christian and I, in September. So go to that website and get signed up for our newsletter, and you can be part of that 2-day program.
Oh, that sounds wonderful. I hope people in Missouri are getting that information and signing right up. So thank you so much again for joining us today. I'm excited you're going to be back with us again next week. And for those of you watching, please come back after these messages for our next guest.